You're listening to an African Elements top news story for July 7th, 2025. Please visit our website at africanelements.org for more daily news. Free preventive care, a crossroads for American health. On June 26, 2025, the United States Supreme Court issued a 6-3 ruling. This decision upheld a key provision of the Affordable Care Act. The ruling ensures free preventive services for around 150 million Americans. Kennedy v. Braidwood was the fourth major legal challenge to the ACA. Justice Brett Kavanaugh wrote the opinion. He confirmed insurers must cover preventive services recommended by the U.S. Preventive Services Task Force without cost sharing. Plaintiffs argued task force members lacked proper presidential appointment and Senate confirmation. They claimed these members should be treated as principal officers. The court rejected this view. It ruled that task force members are inferior officers. The Health and Human Services Secretary has authority to appoint them. This preserves access to screenings for cancer, high blood pressure, diabetes, and more. It also protects services like HIV prevention with PrEP. The ACA took effect in 2010. It aimed to expand coverage, reduce costs, and improve healthcare quality. One central rule requires most private plans to cover preventive services fully. These services include mammograms, colon cancer screening, and osteoporosis exams. They also include vaccines and lifestyle counseling. Removing financial barriers encourages early detection and treatment. Early care can reduce long-term costs and improve outcomes. In 2020, over 151 million privately insured adults gained free preventive access. For many Black Americans, free access helps narrow health disparities. The task force is an independent panel of experts. It grades services from A to D based on evidence. Insurers must cover A and B rated services without cost sharing. The panel reviews new research regularly to update recommendations. Its work shapes the healthcare of millions. The Appointments Clause of the U.S. Constitution normally applies to principal officers. Congress may allow inferior officers to be appointed by department heads. The court found that HHS Secretary oversight qualifies these members as inferior officers. If the challenge had succeeded, insurers could have imposed copays, deductibles, or coinsurance on key services. Statins, lung cancer screening, and PrEP could have faced out-of-pocket costs. Such changes would likely have created financial hurdles for many families. They could have reversed years of progress in preventive care access. The decision is a victory for health equity and access. It secures screenings for chronic conditions across socioeconomic groups. However, the ruling also raises concerns about political influence. The HHS Secretary can appoint and remove task force members at will. This power could shape future recommendations. Recent actions by Secretary Robert F. Kennedy Jr. demonstrate potential risks. He replaced vaccine advisory committee members with critics of established science. He reorganized supporting agencies, leading to layoffs and uncertainty. Critics worry the task force could face similar reshaping. If unproven methods replace evidence-based guidelines, health outcomes could suffer. Maintaining the task force's independence is key for trust in preventive care. The Supreme Court's decision secures free preventive services for now. It affirms the legal standing of task force recommendations. It highlights the need to guard against politicization of scientific bodies. The future of American health depends on preserving evidence-based care. Copyright African Elements.